Hey, thank you. Good morning, everyone. I'd like to call this meeting of the Cook County Public Health Human Services Board to order on this Tuesday, June 17th at 8:31 a.m. First thing on our agenda, I'd like to welcome Erika Ternes as our new Executive Administrative Assistant. And good morning, welcome. Happy to see you here.
Good morning. I'm excited to be here.
Yeah. Do you want to introduce yourself and
Sure.
a little background or anything?
Yeah, I'm Erika Ternes. I've lived in Cook County for, it will be 15 years this November, and I've had a wide variety of jobs. I've been a data manager and a high school choir teacher and a children's librarian, and now I'm excited to get to apply my freakish love of spreadsheets to a new endeavor. And yeah.
Excellent. Thank you. Most people are probably familiar with Erika in the community, but any questions?
Just welcome. We're so happy to have you with
Yeah.
us.
Commissioner White? Yeah.
And you were the administrative assistant up at the school for a while, too.
I
weren't
was
you?
at the school district.
At the very beginning.
Yes, and I managed all of the standardized testing and compiling and managing all of that data. Yep.
Spreadsheets. That's how we remember you.
Awesome. Well, thank you for introducing yourself this morning and being here, and welcome to the team, and
Thank
very
you.
excited.
Thanks.
Next item is approval of the consent agenda. The consent agenda includes our meeting agenda, minutes, financial report. Minutes are not attached here. Abstracts and bills, none of which are on here. Anything we can add onto that, or any questions, or is there a motion to approve the consent agenda here?
Also move.
Discussion.
Yeah, is there support?
Support.
All right, discussion.
Yes, I'd like to add an item with regard to amending the bylaws to the Public Health and Human Services Advisory Council.
And we'll put that down at items for board action, even though maybe it won't be.
Board action.
Action, yeah.
Well, actually, it will be, because I think the board has to vote to approve.
Oh, okay. Very good. Any other discussion? Hearing or seeing none, all those in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. Moving on to our staff report, we have our public health team this morning. Good morning.
Good morning. Betsy and Erika, do you know how to put the presentation up on the big screen? Yes. Awesome. There we go.
Boom.
All right.
And can
Well-
we turn the big screen toward, I guess, no, you all need
It's
it.
on
We have
your
it right
screen.
here.
That'll work, thank you.
Yeah.
Wonderful.
All at once.
Well, good morning to everyone, and thanks for having my colleague Andrea and I here with you today to talk a little bit more about what it is that we do in the public health team with regards to both emergency preparedness and disease prevention and control. Of all the areas that the public health team touches, I feel like this is probably the one that most of you know the most about because of the days during the COVID pandemic. But I think it's important to kind of recontextualize what the scope of this work looks like outside of a pandemic, because there's quite a bit that goes into it that goes beyond what the public saw during the COVID-19 pandemic. So let's see here. Here we go. So this is a statutory area of responsibility under Minnesota state law. So we are required to provide preparation and response to public health emergencies. This image that you see on the right is what the National Public Health Accreditation Board says that all public health departments across the country have to do. And if you see on the bottom where they kind of come up with the foundation for what it is that public health has a responsibility to pay attention to and work on, one of those boxes in that foundational area is emergency preparedness and response. And you can kind of follow it up into what that actually looks like. Those circles are kind of like how that manifests as different topics of attention. One of them is communicable disease control, or in Minnesota we call it disease prevention and control. So that's looking at all sorts of infectious diseases, vaccine preventable diseases, immunization rates. These are things that public health departments at the state level and at the local level have a responsibility to attend to. So we are part of a broader ecosystem of public health partners. We work with our regional partners, the Northeast Healthcare Coalition. That's a broad group that includes skilled nursing facilities, assisted living facilities, hospitals, clinics, and county public health departments all across the Arrowhead region. So that's a group that we're a big part of. That's a group that played a huge role in the COVID response and helping distribute vaccines across the region. We also work with the Community Health Board, which Frank is our representative on the Community Health Board, as well as Commissioner Mills, so that's an area those two know quite a bit more about, but that's our 4-county region, and that's the entity through which most of our state and federal funding flows. So we partner quite a bit with the 4 counties, St. Louis, Carleton, Lake, and ourselves, Cook, to make sure that we are coordinating activities. You know, emergencies and infectious diseases don't respect county borders, so it's important for us to be working with our partners so that we can respond seamlessly and use the resources that we have at our disposal effectively and efficiently. So that's our regional context. Locally, quite a few of these partners, all of them actually, are members of our local emergency preparedness committee. We also have commissioner representation on that group, so Commissioner Sullivan is our representative on that group. So some of our local partners for emergency preparedness and response are Mike Keyport in emergency management, North Shore Health, Sawtooth Mountain Clinic, Grand Portage Health Services, Care Partners, all of our schools. ISD 166 has representation on that group. Tribal Emergency Management, the Forest Service, the City of Grand Marais, Arrowhead Electric, WTIP, and Visit Cook County. We also have gotten representation from different county departments. So MIS attends that group, the Highway Department attends that group, because depending on the nature of an emergency, any one of these could take a lead in responding. And so the fact that we all know each other, we know who to call if something goes wrong, we have plans and policies in place so that we know how we would work together and how we would communicate. All of that is a big piece of what emergency preparedness looks like. And then finally, how's it funded? Who's paying for this, basically? We have, this thankfully has grown since prior to the pandemic. Prior to the pandemic, we had about 10 staff hours a week to dedicate to emergency preparedness and disease prevention and control. So we had very, very minimal funding and time to dedicate to this area. And then, you know, when COVID happened, you saw that change quite a bit. We were definitely spending more than 10 hours a week responding to COVID. And we were able to receive additional grant funding to support that. So this response sustainability grant is the first time in state history that state resources have been dedicated to disease prevention and control and emergency preparedness in the state of Minnesota. So that's, you know, within the last 3 to 5 years, we received some state funding to support this work. Prior to that, there was a small grant through the CDC that supported that 10 hours a week or so, and we continue to receive that at this point in time. And then during COVID, during an actual emergency such as COVID, we did receive one-time grant funding to support what they call surge capacity, or basically building up the staffing and time to respond appropriately. So what our staffing model looks like right now, Andrea Tofte dedicates about half of her time to disease prevention and control and emergency preparedness, and then I estimate I spend about 5 hours a week supervising her and also providing some leadership when it's appropriate, although Andrea is very capable and talented and able to really take the reins on a lot of this. I'll also mention one more piece of the puzzle, which is volunteers. We saw the enormous value of community volunteers during the COVID pandemic, and we really although we don't have an active response that's using volunteers, we do have a platform and a plan to really bring the community in and help us when there's a role for that. And often there is a role for that. It's just how to bring people in and organize them so they're able to help us effectively and know what their role is. So that platform is called Minnesota Responds. I'm going to turn it over to Andrea to talk a little bit more about what she does.
All right. So the slide that you're looking at outlines the core responsibilities for Cook County Public Health that are often behind the scenes, but this is kind of what guides at work. So is absolutely foundational to keep our residents safe, especially in the face of changing climate and community risks. So first we can see in the screen the public health emergency preparedness and response capabilities. And that is outlining the responsibilities related to coordinating plans, people, public health messaging across agencies to ensure that when a disaster or a health emergency occurs, we are not starting from scratch, that we are activating a system that it has been practiced, reviewed, and is ready. The scope of this work broadly includes coordinating with the Emergency Preparedness Committee, also leading the development or supporting the development of the multi-hazard mitigation plan, and that which is tailored to our specific needs in our county. Supporting community shelters, volunteer management, and partner training. Also act as a leader about risk communication and ensure that the communication is clear, accessible by the public, and particularly to vulnerable residents who might not have access to digital or alerts or transportation. So this works follows the national public health emergency cycle that you see in a circle shape, which includes mitigation, preparedness, response, and recovery. And so each phase of these builds on each other. And we tailor this cycle to our rural realities in Cook County, where we have long distances to nearby larger hospitals. We have seasonal tourism, and we have geographic isolation. And that is kind of what it shapes how our emergencies unfold. So the other document you see there is the disease prevention and control. It's recently developed. It's nicknamed My Dog. So alongside emergency preparedness, we manage ongoing disease prevention efforts. So while often it's less visible, this work protects the community health every day. So among the responsibilities outlined in there, that the one we can reflect on are ensuring COVID-19 and flu testing and vaccines are available, accessible, even when federal responses winds down, providing respiratory protection if we have available masks, or for things that have to do with not only viruses, but they sometimes help with overall air quality. We also monitor local diseases and ensuring that we're up to date with the guidance, and that providers or child care centers are up to date with the latest information coming from Minnesota Department of Health. We also support vaccine confidence through direct outreach. We do data reviews, we do educational campaigns, partner with the schools and with the clinic for child teen checkups. So this important function of public health is a bridge between local realities and state-level disease control infrastructure. we have to say that all that we do with the disease prevention and control, which we nickname DPNC, and I probably will refer as DPNC going forward, and EP, which emergency preparedness. These guys, our work is guided through the lens of the age-friendly county designation, so we assure that we are always looking at our older population, homebound residents, and trying to reach out those that avoid getting care or mistrust or have misinformation given to them. And we also care for, keep in mind people with underlying health conditions and mobility issues. So we can go to the next slide. Thanks. So what you can see here is how Cook County identifies the plans that are more significant, for the most significant risks. So what this is outline the most significant risks that we face in the county. So with this wildfire smoke and poor air quality, due to what we know are our terrain, especially there is a wildfire risk up at the Gunflint Trail, and they been preparing for years on drills and have faced a few incidents. So public health here supports with education on smoke readiness and masks available for residents that want to be prepared for those poor air quality days. Sorry. So another risk is severe winter storms and wind events, and for these events often lead to road closures or sometimes power outages or heating system failures are some of the risks associated with those events. And then social isolation during emergencies is something that we are always looking closely to and making sure that we keep in mind those that might be far to reach. And then in the infectious diseases, vector-borne diseases, we are keeping in mind how the climate pattern, the seasonal pattern shifts for warm days or when it starts being the snow melting. And the warmer climate that we are sustaining is allowing that some of the ticks that we did not have up north are moving towards north. And then there is more Lyme disease prevalence in Cook County. So educating about Lyme disease, because it can affect in the long term someone's health. And then understanding that we have infrastructure vulnerabilities. We have an aging housing stock. Some homes are poorly insulated, and we have older residents living in there. And so making sure that also we have places available in case we reach extreme heat events, having ideas where cooling centers can be, as well as where can be shelters for when we have very cold weather events and then someone cannot, for sure, be protected from that cold. So through the Healthy Homes program, we also support in this phase by giving some improvements that can provide a reliable home in events of extreme weather. So in the next slide, what we can see is some of the plans that are supposed to, any local public health department these are the plans that are best practices to have embedded into the multi-hazard mitigation plan. And this includes the medical countermeasurements, or also are known as POD, which means points of dispensing. And then this is in case like this happened, not very much during COVID also is when we were like distributing the vaccines and all that. That kind of illustrates what that type of annex will be having in there. And then the mass fatality, in case we have an event where we have many people in the county. For a county small like this, just a handful would like make a mass fatality category. And then we have infectious diseases or the PANFIL plan, so how we would act. And after COVID, this plan has been updated and a new version is coming. And then access to functional needs, so like how we will make sure those more vulnerable populations don't get left behind. Another annex that will reflect how we will respond to wildfire smoke. Drinking water incidents response, that will be in case there are flooding. For example, last year, when we had our heavy rain event, Minnesota Department of Health was handing out free well water testing to ensure that people was drinking safe water. And then through us, we were coordinating that and being the point person to request that test through NDH. And then something that we would like to have that we don't have yet, but we're working on, is a public health emergency response plan. And it basically like summarizes our role within the emergency management response. And then the risk communication and message map is also something we have on as a goal, short-term goal, so we know how to communicate with our partners and the public in case of a given emergency. And the idea is to have, for the specific risks that we face, already develop some communication, text, and drafts. So. Finally, I'm gonna just briefly touch on this. This is Grace, as explained, the local emergency preparedness committee, and we meet every 2 months. And then we have a mission and a vision. So as you can see, on the green is our mission and vision, and then on blue you can see our recent activities. So, but I will say this group is. It's great to have this group getting together. It was a lot more, there was a lot more attendance during the COVID days. Everybody wanted, we were under an emergency, public health emergency, so there was a lot more engagement, but still we have the key leaders engaged, and we're always looking into our plans and understanding where we at with emergency preparedness in our different agencies. So. I don't know if Grace, do you want to say something on that last slide, and then you can take over.
Sure. Yeah, I'll just say this was another area where we really tried to recenter coming out of COVID, so that we were reminding everyone that there are many more emergencies outside of COVID, and there's the potential for ongoing infectious disease issues that would fall under the umbrella of emergency preparedness. So that mission and vision, that was part of that recentering and really making sure we had all the partners continuing to come to the table and making sure that those bi-monthly meetings felt like a good use of everyone's time. So I feel like we're in a good place with that group right now. This is just a list. I mean, some of this is just hearkening back to what we did during COVID. I feel like that really is a huge legacy of this work in the recent past for us. I'm not going to read them all off, but you can see all the different things that were a part of this disease prevention and control work during the COVID-19 public health emergency. One story to come out of that is Andrea actually joined us as a Minnesota Response volunteer back in the pandemic, and then she became a temporary employee, and then when a vacancy opened up on our team to be a full-time permanent member of our staff, she applied, and we we're glad to welcome her in, and since that time has done quite a bit of ongoing professional development to really ground into what this role is. So she received a scholarship to attend the National Emergency Preparedness Conference this past spring in Texas. And then there's a variety of trainings through the State Department of Health and various state agencies that she's taken advantage of locally and virtually as well. So really, really proud of Andrea for taking that on and for really always looking to improve our efforts here in Cook County with regards to DP&C and EP, as we love a good acronym in public health. So, and then, you know, as we come out of the pandemic, one of the big things that we're looking at with regards to DP&C is continuing to maintain and improve vaccine confidence. And monitoring trends locally with vaccination rates. And that's work we do hand in hand with the clinic. The clinic is the primary vaccinator in the community. That's where most people are going for their flu shot, their COVID shot, their routine childhood vaccinations, to make sure if they're traveling or if they just are not quite up to date on something, that's where they're going. So making sure that we're supporting the clinic in their efforts and that we are kind of taking that bigger picture look at what we see community-wide in terms of vaccination rates, and also what we are hearing both in the clinic and just more generally about people's thoughts and feelings about vaccines. Are there ways that we can communicate better with people? Are there ways that we can make this easier and more accessible for community members? That's a big part of the ongoing work. And then Andrea spoke to this a bit, but one thing that also came out of COVID was a really clear sense of where our gaps are and where our vulnerable populations are. So making sure we're reaching people who maybe have transportation barriers and have a hard time coming in for the vaccine events. Our seasonal workers often also struggled with transportation and just knowing where to go to get information and to access resources. So working with resorts and employers that bring employees into the community to make sure that those people have a clear and easy connection to our healthcare system. Making sure our communication is just huge. We just want people to know what the public health evidence-based information is in a way that they can understand. And we also want to make it easy for people to act on the recommendations that we're making. And that is, as we learned in the pandemic, really no small feat, and that's a big part of this work. And I'll say another big part of this work is maintaining situational awareness. And that's the kind of fancy way to say just knowing what's going on, right? We want to be aware of both what our role is within the public health system. We have partners at the federal level, the state level. We have agency partners in the healthcare system, in other community agencies. And we want to know what's happening at all those different levels so that we can really hone in on what our unique role to play is, and what is our unique role to play in a world that's really changing fast, both in terms of our partners and the resources and messaging that they have going on, and then the kind of external threats out there in the world that might become a bigger part of our reality at any given moment. So some of the things that we're keeping an eye on, impacts of extreme weather events, changing weather patterns, impacts of AI and cybersecurity risks. This isn't necessarily an area that we're leading in, but we're leaning on our partners in MIS, for example, to provide us with information, and we're attending ongoing trainings as well. I already talked about vaccine confidence and access, vaccination rates. That's really huge. An increase in misinformation and disinformation, being aware of what's happening, where people are getting information and what information is out there coming from a variety of sources. There's the official public health information, but then it's also important for us to keep tabs on what's circulating on social media, for example. What are the things that people are hearing from sources that are maybe trusted to them, but don't always align with the public health messaging that we are putting out there. Increasing risks of vector-borne diseases. Tick-borne diseases are huge. That's something we unfortunately are seeing more of and will continue to see more of as tick populations expand and move northward because of changes in weather patterns. And then a gap that we've identified in in collaboration with both Land Services and Soil and Water, is the safety of surface water for drinking. And this is largely, again, related to changes in weather patterns and increases in algae blooms. So some people, you think of people who are camping out in the boundary waters, drinking surface water. How are we making sure that if we're seeing more blue-green algae blooms, that people know what they're supposed to be doing to safely consume water if they're drinking surface water? And then with our partners, so there is, the public health system's a lot bigger than just county public health. And so it includes the resources that come to us in the form of grants, but it also includes kind of how we fit into that puzzle with the state health department and Health and Human Services at a federal level. So one thing we're watching right now is really vaccine guidance at a federal level and how changes there could, in the future, impact us locally. At this point, it's just maintaining situational awareness, but it's a huge part of public health responsibility, so it's something we're really keeping a close eye on to make sure that people have that science-based evidence-based information, and that they have access to tools like vaccines with insurance coverage and that kind of thing. So lots to pay attention to, and lots of work that Andrea does every day to try to keep us all safe. A lot of her work is really behind the scenes when there's not an emergency. But if we go back to that circle, we're always preparing, responding, or recovering. So often the preparing happens in a sort of low-profile way up in our office. So we're always happy to share information. We're always happy to take questions and suggestions for improving. We can only do so much with the time and resources we have, but we try to do the best that we can in the interest of community health. So happy to take questions from anyone.
Thank you. Questions for Grace or Andrea? Commissioner Storlie.
Thank you. Thank you for a great report. Could we have that sent to us?
Yeah, absolutely.
Good.
We can
Then I'll
include the
share it in
slides
the
with the
West End,
minutes.
too.
Yeah, for sure.
I think the impact of our weather situation is getting dicier all the time. So I would say, depending upon you and your office and WTIP, which we need to support, because all of us working together, then we can help people to be safe. Especially during COVID, when I knew that there would be some elderlies that don't even have a computer. So to call them to say, this is the number, that you need to contact for getting a vaccine or whatever. So that's important. I am happy to say that Lutzen Town Hall has the generator. They're getting it installed right now. And so, if we ever need that, I do understand that the Red Cross will support that. So, we have the system there of, if we have an emergency, then emergency manager and the commissioners and you and all of us will be a part of trying to help people in a situation that we don't know. But the generator is getting hooked up, so we're good that way, just to let
That's
you know.
wonderful news.
Any other questions or comments?
I would just say I remember very clearly the day in 2020, probably early March, when I called Grace to my office. And when I was in my 5-year rotation of interim administrator. So she and Mike Keyport came in, and really all the emergencies that we had ever prepared for here were wildfires. And this was an entirely different thing. I mean, you weren't going to gather an incident, command together with a bunch of people because we all had to be isolated. And Grace just did an amazing job. We spent a lot of quality time together, probably every single day. But it's really great for me to see that you've taken all of that stuff and you've prepared. You've built it back in and you've taken those lessons learned. So thank you for doing that. Really, on behalf of the community, it's just great work.
Thank you.
Commissioner White?
And I would like to add, COVID, right, I was on the school board, and I remember leaning on, as a board, Grace. It's like, it was kind of comforting, but it wasn't. But it's like, she would come in and help us, like, what's the threshold, what's the numbers, where, because it was about closing the school or not. That's what it was. And
That was a very challenging time.
it
Yeah,
was
I
a very
remember that well.
challenging time, and it was, but Grace, when she would show up, not that she made any of us feel any better, but it was good that she showed up so we could make decisions based on something
Yeah,
concrete, so.
it's true. I mean, everybody really trusted everything that you were saying. I mean,
Well,
you
and I
were
feel
you were a
like-
trusted voice.
That philosophy of just giving people information to make their own best choices, I mean, that continues to be the philosophy here, because, we don't, despite the broad reach of emergency preparedness and disease prevention and control, we actually, we didn't, in COVID and just generally, we don't have a lot of power. Our power is in really sharing that information and helping people have that access. That's it. So, making sure the school board, for example, had information so that then you all could make the decisions, that was really important. And I think that's still really important. People just need that quality information.
Mr. Gamble?
Yeah, thank you, Mr. Chair. Thank you for the report. It reflects the substance of the learned experience that comes through things that are part of our life. In other words, we've had many discussions about what would we do in this situation, what we would do in that situation, and sometimes they're hypothetical, other times they're actually what our experience is. And learning from those experiences so that we take a look at how we are better in response to them is hugely important. And there are things that theoretically we might make assumptions about, but when we actually live it, it brings more, like I say, substance to how we respond and how we can anticipate. And the report is evidence of that. And when we're entrusted with the responsibility to create structure in response to emergency, it's great to see how we've applied that so that we're better prepared moving forward. About 4 or 5 slides earlier, Andrea, I believe you made a statement, if you can clarify for us, that what we see in all the detail here, I think there was one item that says that our emergency response plan hasn't been put in place or hasn't been drafted. And I just want a clarification. In other words, we've been focusing on these things, but our emergency response plan is something we're working on. It was about
It's like, it's specific. So, can we look at the slides again or no?
Specific to a specific emergency? Is that
Yeah,
the-
so it is this public health emergency response plan. We don't have a section that is specifically to public health like this. So we have all the other annexes intrinsically, but that one right there will summarize all of our role together.
okay.
Yeah, that's
It just seemed that all the building blocks from everything else that was identified, that you would conclude that there would be a response plan, but when that statement was, that's why I just wanted clarification.
And so when it says annex, it's an annex to the multi-hazard mitigation plan that emergency management develops with the University of Minnesota. So at the end of that report, it spells out a link to all of these different plans. And so that's one that we didn't have before. That's like a summary of who does
Okay.
what. It's kind of like an org chart for different kinds of responses. And so
Yeah.
that one wasn't in there in the last iteration, but it will be in this next one.
Okay, thanks for the clarification, yeah.
I really like the last annexation there, risk communication and message maps and just rumor control. I'm sure that's a very easy thing to do, huh?
One of the things we had, so Minnesota Department of Health had a crisis and risk communications training, and they actually came up to Lutsen and did it last October. And it was fantastic. And we had hoped to bring them back for the Emergency Services Conference, but that was right when the funding was pulled by the federal government, and they weren't able to come. And so that was unfortunate, because I feel like the skills there were so valuable to learn and to practice. They would give you scenarios like, there's a hepatitis B outbreak, what are you going to say? And so they would give you all these kind of like you take a wilderness first responder course. They put these scenarios in front of you, and you have to kind of role play. And so they did that in that training, and it was really great. So at some point, if that is available again, I would love to bring them back up here, because it was really wonderful information.
Commissioner Sullivan.
I just want to thank both Grace and Andrea for their leadership and also for the trust you've built in our community. I have experienced, as I do, a lot of wildfire and, response to smoke over the last couple of years. And as I've worked with lake and road associations, there's an incredible amount of trust that's been built between the county and our citizens, and it's because of the response of public health during COVID and your continuing partnership with us. So I want to thank you very much.
Thank you, Commissioner Sullivan. That is, I think, the best possible outcome of the COVID-19 pandemic. So, thank you.
Go ahead, Frank. Yeah.
And again, thank you. Thank you both for your leadership, and especially Grace for your leadership leading up to and during the whole COVID crisis. I did have a couple of specific questions. You talked about the communications, strengthening communications to the aged, the poor, and remote people. Can you give us some examples of what worked and maybe even what didn't?
Sure, and I'll also let Andrea really led a project recently to get magnets to put on your refrigerator. And so that is one example of a recent initiative. But I would say what worked was, I remember we did a train the trainer for communications when the vaccines became available. Because they originally were available to people 65 and older, and we did like a tiered approach. So it was 75, then 70, then 65 and older, because we just didn't have very many vaccines. So we had the hub and care partners and the clinic and PHHS front desk, and we just made them all like places you could call, and then they could help you sign up over the phone, because we were overwhelmed. I mean, our phone was ringing off the hook. We didn't have enough people to answer the phone. But we said on the radio, so again, WTIP was a huge partner. If you want to sign up for a vaccine and you can't do it online, you can call the hub, you can call care partners, you can call the clinic, you can call PHHS, and any one of those places will have someone who answers the phone and can help you sign up over the phone. So that worked really well. I think another example was working with the HR departments at the resorts, because there are a lot of international workers without cars who don't listen to the radio and don't read the newspaper. And so that was our link, was through the HR department to say, first of all, we did events at resorts for vaccination, but then also, because there'd be people who kind of trickled in, maybe they missed the event, and then we would coordinate for them to have like a van from their employer bring them into town. That worked really well. Shared housing came out as a big vulnerability for a pandemic. There's only so much you can do to reduce risk when you're living in a dorm style housing situation. So that was really hard. I don't think that we tried, but that was a really just inherently challenging situation. And I think the visitor population was another one, and so that kind of ties into the magnet project, so I'll let Andrea talk about the magnets.
Thank you, Grace. So we have identified communications as so when we have done tabletop exercises, one especially that I can recall, in which we identified that as vulnerability, or like something that we can reflect on the action improvement plan. And so we brainstorm on, okay, what do they use, right? Thinking about our older adults that they don't have computers, or they're not like with the email or that social media avenue. So then we learned that they will listen to WTIP radio, or that they will trust their neighbor with a message. and that, like the clinic, they have trusted sources where they will go look for information. So our best strategy is to connect the information with those trusted sources. So it could be the hub, care partners, the radio, and our websites as well. So hoping that either through our neighbor, through the radio, or let's say in an emergency, the county has Code Red as the avenue to deliver information that is for emergencies. And that can reach landlines, emails, and cell phones. Also will be, the radio will probably air that a Code Red was issued. So we, as public health, have a great relationship with the WTIP, and we rely on them. Let's say for air quality alerts, they are the ones that can, a few times a day, give an update on what is the forecast for that. But what we can do in public health is have the information available in our website so people know what they can do if there is poor air quality. Where are their resources, how to learn, those different colors that their alerts will have, and what they could get from us. For example, masks. They can come and get a mask if they have to be outside when the air quality is low. So those have been the ways, and then magnets have been always really welcome by visitors, by vacation rentals, or by any household. So we have one that we developed last year with the CHP, which is the Community Health Board, another entity that is our partner. And that is for the air quality, and it's called Know Your Air. We have that at PHHS. You could just pick up a magnet. And then we created one that is for power outages, and that is structured in a format of prepare, respond, recover. So it tells you what you can do, in each of those scenarios. And then on our website, that one, the power outage, is meant to be magnet, and it has a handout that you can find like more in-depth information if you want to get ready, like how to build the Go kit and where to get that, more information. So our communication strategies have been following a model that is like bite.
It's called bite, snack, meal. So the bite would be the magnet. It's the small, short, you didn't read the whole thing, so here's 3 bullet points, what you should be doing. And the snack is like maybe a social media post, or a little bit more, maybe they say a little more on the radio. And the meal is you go to the website and you have a link to all the different resources, and it's a bigger handout. So that's the idea. You can have a bite, a snack, or a meal. And that's a communications strategy for public health.
Well tested. Thank you. Thank you. I appreciate that. I believe the county, correct me if I'm wrong, has a reverse 911 system where we can broadcast out calls, and I don't know to what degree it can be segmented.
I think that's Code. I don't know if it's exactly the same. I think the closest that I know of is the Code Red system. So it's an emergency alert, but it's an opt-in. So that's the challenge, is if you're not opted in, you're not getting the message. So trying to encourage people to opt in is part of the strategy.
Okay, well, maybe it needs more work because I didn't even know about it.
Right,
Yeah, it does.
So is that segmented, so you can say, well, just Gunflint Trail for this evacuation, or just people over 70 for this vaccination?
Well,
it is segmented like
yes.
that?
I don't know about 70.
I don't think by age,
by
but by geography. So you could say, just the Gunflint Trail, but you couldn't say, only people over 70.
So how do you opt in?
On our website. I can put the link in the notes.
How do you know that you're supposed to go to the website to opt in if there's something?
Well, that's on the magnet. That's, it's gone out in social media posts, but it's definitely an area for improvement of
Just
making
a
sure people know.
suggestion to
Yeah,
republish
I would agree. That's a
the,
good idea.
alert.
So related to Code Red, a number of years ago, I want to say maybe 10 years ago, we sent a postcard
to every property owner in Cook County that talked about how to opt into Code Red. And that way, even if they weren't here at the point in time, that postcard got mailed to their mailing address and they got the information. We had a large number of people that opted in. A year ago, it was being discussed between Mike Keyport and Sheriff Eliason about doing it again because we've had such a change in our population over the last decade.
Absolutely.
So I believe that that is in the works, that there will be a postcard going out. And I know I saved mine and they requested it as a model for looking at what they were going to put together.
Excellent, thank you. And maybe as the commissioners, through your various constituency outreach at all the homeowners associations, maybe this is something that could be mentioned.
Yeah, we have been.
Have the opt-in list there.
And I would say that it's not just about people opting in, but the sheriff's department and emergency management needs to regularly practice Code Red and make sure that their staff and their dispatchers are like trained on how to do it, so that they can send out a message quickly. So that's kind of a bigger picture of things we need to probably address.
Yeah, opting in is the first step, but it's not the last step.
Right, right.
How does one get their hands on a magnet?
My trunk. My car is filled all summer, so if you'd like one, otherwise upstairs, there are plenty. They're distributed through a lot of community events.
Because I think of like different locations, like down at the hub, but I actually thought about some of the summer people that come up and they're not really tuned into the, like having an emergency. They are getting their trees cleared, but because I would pick them up and go get in their houses or put them on their doors or something, because it's, when the emergency happens, that's not the time to.
Yeah.
Absolutely.
The
I think,
magnets, you could put them on the outside of the mailboxes.
oh, that's a great idea.
We don't
Not
have
inside.
we don't have mailboxes in Hovland.
Deb, my trunk after this meeting.
Yeah, and then I have more
Sounds like
upstairs,
some
and if
sort
you'd
of
like to
deal.
take a stab to.
I
yeah.
would, because I know a number of people that it would.
Absolutely. There are some at Care Partners as well, and then we are, then the magnets were ready about a month ago. We had them ready for the Emergency Services Conference. And then our next step, like right now in the summer, is like distribute them, make sure that I can connect with the vacation rentals. I have reached out to Visit Cook County and then see if through their Chamber of Commerce I can reach out those vacation rentals, and then you can go to those places as well. So I'm trying to find the key places, like you mentioned, the hub. I haven't reached out there yet, but for sure there are Kid Partners, which has a lot of like people coming in.
And then I think, like, we all know people that they're, well, maybe not, they're reclusive, you know, they're just in the woods, they're just, like, if there's an emergency, it's like, who's going to go check on these people? I mean, as neighbors type things, and that would be, we just hand deliver to these folks, because they're not going to come out seeking
Yeah.
social
It's
interaction.
a challenge to, you know, if someone is staying home, they're staying home, and, you know,
Yeah.
it's a challenge to reach folks who are maybe opting for a more isolated lifestyle. So if people have ideas, feel free to reach out to Andrea, and we're happy to be creative in how we distribute these. So just let us know if you have ideas or if you want some to distribute yourself. We can always do a reprint, but I think it's a great tool. It sticks on your refrigerator so you can't lose it in a pile of mail. That was the idea anyway. So yeah, reach out and we'll be happy to brainstorm creative distribution techniques.
Maybe you could bring a few to the next meeting and just, I'd like to see what's.
Yeah, I mean, we could bring them down, we could bring some downstairs before the committee of the whole too, if you all want to take them with after the meetings today.
Might consider a fisherman's picnic instead of throwing candy, throw magnets.
For sure, we'll have them at the fisherman's picnic. We had some
I don't
of
know
the
if we'll throw them.
Yeah, we had last
We won't throw them, but we will have them in our booth, you know, for sure. We will have them at the
And the Grand Portage
Portage
Health Fair
Fair.
this weekend. So.
Right, well, thank you very much. Oh, Frank, go ahead.
Thank you. Another topic, the flu vaccination rates that you mentioned. Can you give us a handle on what are the, flu vaccination rates for flu, measles, And COVID boosters?
I can't tell you them off the top of my head, but I can get that information and have it present at the next meeting or included in the notes for this one.
Thank you.
I can say just roughly. On the measles vaccine, the one that I give more, because of we have had 2 measles cases in Minnesota in the last month or so.
In Minnesota?
In Minnesota.
Not the county.
No, Cook County.
Get alerts about that.
Right.
Yeah.
And then it was, there was an outbreak of measles a couple years ago, but the one that it was currently happening, that had an outbreak in Texas, in another state, and then it hadn't reached Minnesota yet, but it did reach Minnesota. One of the cases was at the Mall of America, and this was about a month ago, 3 weeks, something like that. But since then, we haven't received any more notifications like statewide, because the Minnesota Department of Health Epidemiology Department issues alerts when there is something relevant that should be distributed to all hospitals. So that would be like my role. I get those alerts, Grace gets one copy of the alert, and then we send to the hospital, clinic, and Grand Portage Health Services. So when we look at our vaccination rates in the county, because we have such a small population, if there is one child that doesn't have the vaccines up to date, then it will show us like we're at like 90%. But we're pretty good. I think there is just like a handful or even less kids that are maybe not up to date. So our population is less at risk, because the populations that are more at risk with measles would be unvaccinated populations. And kids that have gotten measles, those cases were unvaccinated populations. And then the flu vaccine it usually is around 30%.
About 30?
Mm-hmm.
I'd say, yeah, it's between 30 and 40 on any given year, typically for flu coverage. So there's definitely work that we could do there. And yeah, I'll be happy to get a more comprehensive picture for the next meeting, because I don't have all of the rates on the top of my head.
Sure. All right. Wouldn't expect people to just pull them right up. Thank you. And my final question was, you mentioned the vector-borne diseases, ticks and mosquitoes, presumably that's the big two. Which ones are prevalent in Cook?
So we do not have any mosquito-related vector-borne diseases. We only we have the deer tick, which will be the one that is likely to give you Lyme disease. But there's also anaplasmosis, babesiosis.
So we don't have them.
We haven't had two of the other infectious diseases in the county. No, but we did have the one with the B. I can't say it. I can't say it right now, but it's something like babesiosis, I think. I'm sorry that I haven't ingrained that scientific name. However, so 2 of those cases, those are like flashes through your body in about 2 weeks, fever and chest congestion. But Lyme disease is the one that is most concerning, because it has long-term side effects. And then for Cook County, that number of people that has had Lyme disease detected, which doesn't mean, like this is something that our epidemiologist always makes a point, it doesn't mean that the tick, it was like in their body here in Cook County and bit them and give them Lyme disease. It means like the residence is from Cook County, could have been bitten in Finland, in Lake County, in St. Louis, okay? But so with that in mind, still the Lyme disease cases for Cook County have doubled. But they're low, so it's like 4 now, 8 or something. But because we're such a low population, just a few more cases increases, but it has increased, and still is a pattern that we're seeing for the Northeast region.
So it's something to watch, but not something to
It's
emergency
something.
response on.
Try
Okay.
to educate our population that preventing a tick bite is important, because when you get Lyme disease, as HR has shared, you could have like many days of sick leave. You can sometimes, it's depending on how it affects you, You can lose many days of work because of Lyme disease.
Yeah, no question, Lyme disease is a very serious disease, but if we don't have the deer ticks up here that spread it, probably not a big public.
But we do
We do. That's one of the changes with the weather patterns is that we're seeing longer seasons of tick activity, and we're seeing populations of ticks move northward. And so that's why Lyme's disease cases have increased both within Cook County and within the Arrowhead region. So some of the messaging around that we've put out there is, how to prevent tick bites and also the importance of doing tick checks daily. If you have a tick that's bitten you and it is infected, the sooner that you get it out of your body, the more likely it is that you won't have that disease passed on to you. So within the first 24 hours, if you remove that tick, the likelihood of you becoming ill is very, very low. And so that's a really good practice. If you've been out in the brush, out in the woods, just do a tick check before you go to bed. That's one of the best preventative measures for things like Lyme disease. And then knowing that you can certainly call the clinic if you feel like you are feeling ill, and they can prescribe antibiotics and they can test for things like Lyme disease afterwards. But best to try to prevent that from happening in the first place by doing things like tick checks and treating clothes with permethrin and all of that good stuff, tucking your pants into your socks and all that.
One of the things I want to note is ticks are part of our environment, and we have them and we see them every day. It's like if you so one of the things to say is not all ticks carry Lyme disease. It takes about 24 hours for a tick to be attached to your body for the Lyme disease to be transferred to your body. That's why those tick checks are the most important, throughout the day. If you're on a hike, every a few hours, check your body, because even if you had one latch on you, it's very unlikely that you'll get Lyme disease if you cut it right away. So that, yeah.
All right. Lots of information there. I'm sure there's more to come. Thank you very much
We could talk for hours.
Yeah. No, I appreciate all the information, and I'm sure there's more to come, and appreciate that too. So thank you for the presentation this morning and all your good work, and carry on, eh? That moves us on to item 5, our director's report. And this morning we have our fiscal supervisor, Plamen Dimitrov, filling in for Allison. And we have our staff updates and agency updates. And I suppose between you and Rena, you can give us all the info we need here.
Good morning. My name is Plamen Dimitrov, and I'm the fiscal supervisor for Cook County Public Health and Human Services. And I'm here to to deliver the director's report today. First off, I would like to extend another warm welcome to Erika. Erika comes to our agency with a lot of experience and a lot of talent and a lot of knowledge, and we are very happy to have her on board. So thank you. Another thank you to Grace and Andrea for the great presentation today and for taking all these great questions. Thank you so much. Just a reminder that Cook County Public Health and Human Services offices will be closed on Thursday in observance of Juneteenth. And I have some notes that Grace shared with me that would consist of the director's report today. And if you allow me, I would read through them here today.
Thank you.
The annual bike rodeo took place at the Cook County Community Center on Thursday, May 22nd, and was attended by 53 youth and 35 adults. Volunteers distributed over 30 helmets at no cost, thanks to the generous financial support of Joins Ben Franklin, Spoken Gear, and the Nurture Collaborative. Refreshments and an infamous blender bike were also available, thanks to a donation by the Cook County Co-op. Public Health and Human Services Department staff attended the Pride Festival at the Harbor Park on the 14th of June and plan to attend the Grand Portage Health Fair on the 21st to provide the community with health information and information on services that Public Health and Human Services provides. Andrea and Andrea Tofte gave a presentation on the Cook County Healthy Housing Program at the Minnesota Department of Health Rural Health Conference on the 9th in Duluth. A draft of the age-friendly Cook County Action Plan was on display in poster form at the Care Partners Open House. This was a collaborative project between Care Partners and the Public Health Team. We aim to have a written draft report available to the public by August, which will be linked to a future Public Health and Human Services Board packet later this summer. Andrea Tofte connected with the AARP and Cook County Higher Education to bring the home fit presentation to Higher Ed on the 26th at 11 a.m. This work combines elements of both our age-friendly and healthy housing work. It is a presentation by an architect who is a certified aging and play specialist and provides practical tips to consider to older adults who want to maximize the time they are able to safely live in their homes. This class is free and open to the public. The Oral Health Task Force, of which Public Health and Human Services is a contributing member, won the 2024 Rural Health Team Award. This task force includes representation from Sawtooth Mountain Clinic, Grand Marais Family Dentistry, and Grand Portage Health Services. The aim of the group is to increase preventative dental care and access to dental services. Angie Works has accepted the position of Family Health Nurse at the Sawtooth Mountain Clinic. This is a position that Public Health and Human Services contracts out to Sawtooth Mountain Clinic to perform certain public health functions. These include administering of the Women, Infants, and Children, or known as WIC, Nutrition Assistance Program, various perinatal nursing services, and maternity early childhood sustained home visiting program. Grace is working with the leadership at the Sawtooth Mountain Clinic to ensure that Angie has all the tools and support she needs to take the administration of these contracted programs. The 2026 Public Health Fund grant period is open for applications through July 1st, with all relevant information on our website. The grant review subcommittee will meet several times through the summer to interview applicants, review written applications, and provide the PHHS board with funding recommendations by its September meeting. On June the 23rd, marks the 1 year anniversary of the Cook County Prevention Coalition. We are planning a year in review celebration, along with presentation of the strategic prevention framework from our regional alcohol, tobacco, and other drugs regional coordinator, Laura Bennett. We're also planning to discuss the kickoff of the youth-specific coalition planned for later this summer, alongside a youth interview project led by Rocio Rivers, our youth prevention specialist. Grand Portage Health Services, Nurture Health, Public Health and Human Services, and the Sawtooth Mountain Clinic have been meeting to discuss the creation of a cross-agency resource directory website that helps community members more easily connect with the health-related resources in the community. The startup funding for this project comes from the COVID-19 Implementation Fund grant that was rescinded, then reinstated these past 3 months by the CDC, Center for Disease Control, and then in turn by the Minnesota Department of Health, MDH. The RFP is currently out with a deadline for bids of July the 14th. Lastly, on the June the 30th, Andrea will be facilitating 2 question persuade refer classes at Cook County Higher Education. One is at noon and another is at 5:30. QPR is an hour-and-a-half evidence-based program that has its mission to save lives and reduce suicide behaviors by giving attendees the education to recognize a crisis and warning signs that someone may be contemplating suicide, and also to access local and national referral services to get help. These classes are free and open to the public. And that is the report.
Thank you. Any questions for Plowman? Might be able to answer. All right.
Uh,
Oh, I'm sorry, please go ahead, Frank.
I'm sorry, I missed it a little bit. Could you just repeat the funds that were impounded or tried to get clawed back and then was reinstated? Which funds were those?
That is the COVID vaccine implementation grant.
Right, okay. Okay, very good. And how much of that was left, how much of that did the county have left to spend, which has now been reinstated?
So we had
About.
roughly about 30,000 of our allocation that was left to spend.
Yeah, right.
However, because of some of the uncertainty related to this grant, because it was first rescinded and then it was reinstated, some of the local partners, other members of the community health board have opted not to use those funds. So
Right.
more funds have become available to us to spend.
Okay.
More than the original award amount that was.
Okay, so the money comes from CDC to the state grants it to the Community Health Board, and our original allocation was 30,000, but if others opt not to take it, then that would be available too. Great.
Correct.
What can we use that money for, and how fast can we spend it before they change their minds again?
Grace has a great plan on that, and I'll let her describe.
It's all of that.
Right now, we're planning to spend it on the development of the resource directory website, and that's the project with Grand Portage Health Services, Sawtooth Mountain Clinic, North Shore Health, and it's based on this idea that coming out of the pandemic, all of us independently at our different agencies have heard that people don't always know what resources are out there in our community, and if they do know about them, they don't know how to connect to them.
Absolutely.
So the idea is that this would be a pandemic recovery activity. So we did get this okayed by our grant manager at the Department of Health as a recovery activity.
Right.
And that we would work with our county attorney, and once we get a bid for the website development, we'll make sure that it aligns with our new contract language, because the funding it's here today, but we want to make sure that we can spend it responsibly and not find ourselves in a position where it's rescinded again, and we're on the hook for an expense like a website design. So we're going to be working very carefully on, when we get those bids back from website developers, aligning our contract language so that we can basically make a few larger purchases with the grant funds. And then there's some additional costs associated with the project, like, branding, a logo, ongoing costs for outreach, for example, and could we spend those up front, and then in the interest of kind of mitigating the uncertainty with this grant. That's the plan right now.
Great, thank you.
Thank you. All right, any other questions? Looks like not so much. We'll move on to items for board action. What we had changed there was the addition of the bylaws amendment for the Public Health Human Services Advisory Council. And we discussed this a little bit before. I'm sorry.
No problem.
And kind of the long and short of it, at least my memory and understanding, was that we had challenges with membership, and because of how the bylaws are written, that was making it difficult to elect a chair and vice chair. And so you need to be on the council for 2 years, or 1 year. Frank, do you remember this? You were on the.
Yeah, you have to be on at least 1 year.
1 year before you can be vice chair.
Or chair.
Or chair.
Or chair. And actually, if you turn to page 34 of 39, the change is marked there.
There we are.
Subsection B.
We blue lined it.
Yep. Now, this was reproduced from our original agenda. Commissioner Gamble, you help me recall, please. Did we adopt this as, I don't have the, recent notes.
The recommendation came from the advisory council.
Yeah, yes.
To do this. So we had the discussion, and then it just had to come to the Board of Commissioners, or
Board.
this board.
For approval.
Yeah, for approval.
But was this the, I believe this is the final wording that was recommended at the,
Yes,
from the advisory council.
yes.
And so it looks like the only change is the striking of chairperson needing 1 year, and then a grammatical change in the next number there. Is that right?
Yes.
Yep.
Yes, and there was other discussion that the vice chair would be mentored, or any other members for that, but all new members, as a matter of fact, would be mentored by existing advisory council members as to the duties, roles, and responsibilities during their first year.
Please.
Yeah, thank you. So the discussion was because of the challenges, which are sort of culturally a challenge on many fronts, filling positions and having volunteers. And the other thing, I think, in having people step forward is making sure that they're clear as to the responsibilities. At least that's been my experience sitting on different committees. What does it mean if I'm put in that position? And so we had that discussion, and based upon what informed the initial bylaws, we wanted to make sure that we kept the integrity of that intent in this proposal. And so the mentoring aspect was reflective of that. If we didn't have the commitment that had that tenure leading up to the appointment, that we would make a commitment to be sure that what our intent was, that we would mentor into those positions.
Yes.
So it wasn't just a proposal that was to make it easier. It was to try to be protective of intent and still accommodate change of culture. Yeah.
Appreciate that. Any
So-
further? Yeah.
Well, again, if there's no further discussion, as the chairman of the Public Health and Human Services Advisory Council, I'd like to submit this change to the board to be voted on and approved as an amendment to the bylaws.
Any other questions or concerns before we? Is that a motion then, Frank?
I don't know if I should make the motion as chairman of the advisory council, but if I can, I will.
There is a motion. Is there support?
Support.
Okay, we have a motion and support. Thank you, Commissioner Sullivan. Further discussion? Thanks for working on this. All those in favor?
Aye.
Aye. Opposed? Motion passes unanimously.
Thank you.
Thank you very much.
As a codicil to that, I would encourage our commissioners, as you make your homeowner association meetings this summer, to mention to them that we are looking for this, and we do want to, one of the other things that we discussed was a letter to the various homeowner associations, something that they could make a note of, either through an email to their membership or to raise at their meetings, that this is what we do, and this is what we are looking for, and we invite applicants. We'll work on that.
Great. Moving on to committee reports. First one is the Active Living Steering Committee. Commissioner White. Take a moment. Sorry, I saw you did something, but I didn't see what. You took a bite.
Yeah, I did.
Oh.
I'm
sorry.
Next thing is you're going to move towards the meal, so.
That's the next meeting.
Yes.
Yeah. The active living, there was a lot of discussion about the progress with the paths, DNR paths, bike paths through Lutzen. Ginny probably has even been on them. And then the Gitchigami Trail. And it's, again, funding is an issue, but it's not enough of an issue that there's still funding in place for these projects. And then, of course, the active living, I guess that was the safe routes to school. There's a lot of people and a lot of organizations in this county that's focusing on moving. So that's what I can say about that.
Like movement or?
Movement. Oh, yeah,
Okay,
not
yeah.
like moving out of
Well,
the county
that's-
or driving. It's like footwork
Sure.
or something like
Yep,
that.
yep. Thank you.
exercising.
Yeah. Next one is the AEOA. Commissioner White?
Well, AEOA and the Council on Aging are both going to be here just in the
Okay,
next.
so don't ruin it, right?
I'm not going to
Yeah,
ruin
no
any surprises
spoilers.
about them, none at all. But one statement is that this county receives so much from the Arrowhead Economic Opportunity Agency that we don't even think about it anymore. So they'll tell us all of their details, but we are really fortunate to have that organization have our backs.
Yeah, and as much as they do for us, it's just the region too.
Yes, it's not just us.
incredible, yeah.
Yes,
We get a lot ourselves, but yeah.
right.
Yeah. Well, great. We'll look forward to that conversation. Next one is the Arrowhead Health Alliance. Any updates there, Commissioner White?
We are having a meeting on Thursday,
Okay.
and it's been nothing other than administrative corrections or editing on their contracts.
Oh, okay. All right. Arrowhead Regional Corrections, Commissioner Gamble.
Thank you, Mr. Chair. There was, on the update in Cook County relative to our offices, the probation office services include the Grand Portage Reservation in concert with the tribal probation officer. Staffing stability has been achieved, so we had much discussion about the various counties that participate in NERC and the Arrowhead Regional Corrections, and so the update, they were very pleased to say that our staffing stability in Cook County has been achieved. All positions are filled, and we anticipate having long-term probation officers in place. There are only 2 probation officers, so each one handles all types and varieties of cases. They have a substance use treatment court that continues to run, and we have a partnership with the Grand Portage Tribe. We have a presence on their probation steering committee and are actively involved in the hiring and training of their probation officer at Grand Portage Tribe. Also noted was that probation officers are to be considered change agents, not service brokers, which I think is a good notation for people to be mindful of. The other, I think, thing that the public would be interested in is that NERC has issued a state bonding request for solar panels to be installed at the facility.
Well, that's amazing news regarding staffing, especially knowing the challenges around the state and the challenges we've had. I did not see a way out or an easy path forward, and that's amazing. So thank you for that update. That moves on to the Child Care Solutions Subcommittee. Commissioner Storlie.
We have not met.
Okay. And then I'm afraid I missed the Community Health Board, but I presume Frank was there and might have.
I was.
Yep.
I was, and it was a abbreviated meeting, but the main thing I'd like to bring to the board's attention is that there was a slight change in the mission statement to reflect current guidance regarding language to be used, or language, forbidden language, or language which would raise red flags in funding and grants in our activities. So as a preventative measure, we made a change which was designed to be more compliant with executive orders, but without changing the fundamental mission of the Community Health Board, to the extent talking about serving all populations without actually using the word equity. Whether this needs to be replicated at other levels, we don't know yet, and how far it has to go. But there was a deep scrutiny of the websites and website and all other forms and applications that we have to be looking at. One of the criteria that's often used is the Social Vulnerability Index. I don't know if you're familiar with that, but that's often something that is used and referred to, and it was suggested that that might be a good idea not to focus on that in future grant proposals and RFPs.
So careful what you say, your money might get taken away. Thank you. That moves us on to Local Mental Health Advisory Council. Brianna.
We discussed the past year's work, and so it wasn't really anything new
Okay.
as far as I know.
Okay. Review.
Reviewed the year and the progress, and I'm just always impressed at how much it is done by public health here.
Moves on to Restorative Justice, Commissioner Gamble.
Thank you, Mr. Chair. The State Restorative Practices Grant awarded our program $300,000 in monies. We had asked for 400 and some thousand. They granted the 300,000, which was good news, and that will begin next month, receiving those fundings.
Thank you. Council on Aging, we'll get to at the Committee of the Whole. Emergency Preparedness, anything additional there, Commissioner Sullivan?
Yes, we had an opportunity to have a meeting last week led by Andrea. Mike Keyport as our emergency manager and Grace were gone at a conference, and Andrea did an excellent job. Talked a little bit about the work being currently done on the hazard mitigation plan. And then one of the things that I contributed at that meeting was the vast number of community events that we are providing outreach to, whether it be for wildfire, smoke, learning about evacuation, code red, all of that. And we have 21 events during the summer that are being held where we will be present. And all of those but one are along the Gunflint Trail. And the outreach is to about 750 people out of 1,100 citizens living in that area. That would include seasonal residents. But it's a great outreach, just a great partnership that we have. And I'm in the process of securing Andrea to cover 3 of those events where I have conflicts. We have 2 events or more on one day. And so anyway, we hope to get that secured and wrapped up this week. But it's really, again, a fantastic partnership that we have, and a great way to get information out not only to our residents but the seasonal people that come. And then we also talked a little bit about the mid-trail evacuation, which I touched on at our county board meeting, but for those that weren't there, we practice annually and take one roadway, which we do a practice, and our volunteer firefighters go door to door, show what the poster is that gets placed, and talk about evacuation plans. And one of the scenarios that was reviewed this time was residents, or I shouldn't say residents, but visitors to a campground at Flower Lake, which had no ability to leave in the case of evacuation. There was no vehicle. They were just there camping. And so we determined a way to engage residents who we can rely on and count on, who live in the area, to help with evacuation, because our firefighters are going door to door. They can't take the time to bring people out of an area. So it was a very valuable drill, and talked and discussed at the end communication and use of the ambulance, when to use it, when not to use that ambulance. And so I'm looking forward very much to next year. Rather than next year being an observer, I will be participating actually in the drill with firefighters. So I'll come with a new level of information to share with everyone.
Thank you. Healthcare Planning Committee, Commissioner Storlie.
We did not meet.
Okay. Anything from NACO?
Yes, we did meet. Well, just a couple highlights. Going back to childcare, the federal government understands the need for families to have some kind of monetary support. So the legislators passed a $2,700, I would say, contribution to families The Senate is looking at only 2,200. So for that decision and for Medicaid, they're hoping to get everything passed before July 4th. So we're just going to have to wait and see what happens with all of that with the hierarchy of the federal government.
Commissioner, is that amount of money, is that a tax deduction or a direct payment?
Direct payment is what I understand.
Direct payment. Okay.
If I may, I believe that is it's a tax credit, and if you don't pay that much in taxes, they will refund you. It's a refundable tax credit. So if your taxes were $1,000 and it's $2,200, you don't pay your $1,000 in taxes, and they will send you the check for the balance. So it's a refundable tax credit.
Okay.
As stated today.
Again,
know.
there are different versions of
There's
the bill,
different
but that's what it's
versions.
been. I mean, they're just talking about, they're not changing the program, they're just
No.
talking about the amount.
And this is federal, right? Yeah. Well, good. About time.
And this was raised from last year, it was 2,000,
Yeah.
now going up to something else.
Sure, 22 or 27, yeah. Thank you. Moving on to the Northeast Minnesota Office of Job Training, Commissioner Gamble.
Meeting coming up in July.
Okay. The North Shore Collaborative, we had a cancellation for our May meeting unless I missed something there, but no. And then Public Health Advisory Council, anything additional there, Frank?
Again, thank you for
Yep.
passing the proposed amendment, and as our interim director mentioned, that we are now in active season for our grant funding program. Budgetary considerations, again, Grace does a great job of organizing our meetings and our plans, and I believe we're just going to go on an assumption of what we will have to distribute, and we will be, of course, finally subject to the full budget decisions made by the board. Grace, did you want to add anything about our upcoming considerations?
No, at this point, we have everything on the website live, including a recording of the information session for prospective applicants. That recording of that info session is also on the website, so if somebody missed that but wants to get more information, they can watch that recording. I believe the amount we have included in our draft budget is the same as we had last year, so it's static.
150?
I can't recall off the top of my head. Blaman, do you recall what we have in there? I have to pull it up, but at this point, the application period closes on July 1st. So we have a couple weeks yet for applicants to send in their materials. And again, all that information's on the website, or if someone has questions, they can give me a call.
And in reviewing last year's program with a set aside for new and innovative programs, I think in reviewing that, we thought it was successful in its purpose of generating new and innovative ideas and new applicants, and with some minor changes that will continue going into the current grant season.
Thank you. Moving on.
Plummett's good.
Plummet, I'm
I
sorry.
just have that amount, it's 190,000 for
190.
for year 2025,
Okay, thank you.
which was an increase from the 150 in 2024.
Thank you.
Yeah, I'll be real curious to see where all that
Yeah.
shakes out. Thank you for working on that. The Cook County Prevention Coalition, Commissioner White.
They are talking about mental health and, like I said last time, mental health and substance abuse prevention. It's a high-energy, hopeful group. They give off a vibration of it's a real can-do, and they will be empowering youth to carry the message too. So I really like that group. So, and then I haven't shared this at all yet, but ARC I don't know the woman's name, but I was told by the person who is leaving as the facilitator from ARC for the North Shore Management Board, she's going back to work in her department at ARC with aging. But a person she works with would like to get together and develop across the region groups, well, it's not like the grandparent program per se, but integrated groups of an adult to just get together once a week and talk with kids, just sit around and shoot hoops or just talk about things or share a pizza, but to get the generations an opportunity and a safe place, because many kids don't have a safe adult or a normal adult, which would be hard to find in this county, but just somebody that they could trust and they could just get kernels of wisdom or great stories to tell, if that were the case. So that will be, I was contacted by that person saying, are you interested? And I said, yes, but I've gotten no more information. But I will be sending that along to the people on the prevention board, so.
Is there like a name for the program, or just?
Yeah, there is, but it's not
Okay.
in my head at this
Okay,
moment.
that's fine.
It was a verbal conversation as we were all leaving, so.
Okay. And then, as far as the Cook County Food Access Council is concerned, I attended late due to a conflict with the DCYF meeting. But it's largely mission vision discussion. One takeaway I kind of picked up at the end too was just about a little reticence, I'd say, about being an official county, government group versus a coalition of independent, and so I think there's going to be more discussion just about implications or structure and format and that sort of thing. Any other details there that you wanted to add?
Were you at the part
beginnings.
of the extension presentation on Super Shelf? Were you able to hear that?
Oh, maybe I missed. Yeah, no.
There's a woman named Linda Erdahl who works for the U of M extension out of Duluth on a project called Super Shelf, and it's a model of making food shelves include more fresh produce and healthy foods, and making them very consumer oriented. So she did a presentation, and we had representatives from the local food shelf there as well, and a lot of interest in learning more about our local food shelf and hearing more from Linda. So her role is to help food shelves in Northeast Minnesota adopt portions of this Super Shelf model if they're interested. So she was
Focusing on
a
that.
great speaker.
Yeah. No, I missed her altogether there. So maybe I missed a meeting altogether here. That's what I'm wondering.
I don't know.
So-
It was 2 weeks ago, a week and a half ago, I guess. 2 weeks ago tomorrow.
Yes, I missed that. Yeah, I was traveling with family. Commissioner Gamble.
Yeah, relative to the food issue, when we look at resources that are available in the county, and the food shelf certainly is one of them. The other is Ruby's Pantry, and when I think Ruby's celebrated its 10th anniversary here not too long ago, but participation, and I think there must be a consensus as to the type of food that we're getting and that is available to us, and that is food that is healthy, the fresh foods, the things that provide protein, and I think in looking at those programs so that they're attractive and that they meet our intention, which is to provide good food for people that want to avail themselves of those resources. Whatever we can do to influence those things in the Ruby's Pantry situation, it's something where, organizations donate that food, so you get what you get, but I think just the message underscoring the importance of making sure we're giving substantive food and not food that's detrimental when it comes to the health issue.
There have been a number of organizers from Ruby's Pantry who've been really active on the Food Access Council and have brought up that very issue.
Yeah.
So I would say there's a lot of passion in that group, a lot of people who have put in a ton of work to
Yes.
help Ruby's Pantry function, the food pantry or the food shelf itself. So there's a lot of passion, I would say, in that group. And I think there's recognition of that very issue, that there's not a lot of choice when it comes to the Ruby's Pantry program, just because of the nature of the way it's set up. And there's also been some frustration voiced in that group by some of the organizers, just because
Sure.
there isn't that choice of how to. You kind of get what you get. They bring
Yeah.
the truck up, and whatever's on the truck is what goes out. So that
Yeah.
is a challenge that's come up in the context of the
Yeah.
Food Access Council.
Yeah.
So I think it's definitely on people's minds.
A lot of organizations that start out, with their founders, with the intent of what they provide, and sometimes it can drift a bit, just making an assumption based upon, the tendencies sometimes that come with people that have vision and what they're advocating for. And I think just from our standpoint, whatever we can do so that leadership of the program negotiates with people and makes those decisions on behalf of the end user, so to speak. I think that's an important thing, just to respectfully encourage that we share those similar values in how the program provides.
Thank you.
Last thing is for the good of the order. Anything else someone would like to add there? Then we're adjourned. Thank you.
Absolutely, no problem.
Thank you so much. Oh, great.
Why do I talk when I have half?
Okay.